Knock, knock, knock. Come in. Yep. Uh, Hi, my name is Min. I'm a student nurse. Can you please tell me your name and your birthday, please? Um, okay. My name is Mr. John. My date of birth is November 9, 1995. Uh, Hi, Mr. John. So, the doctor ordered the tube feeding now. Can I get you ready for a tube feeding? Yes, sounds good. Alright, so Mr. John, you have any allergy with nutrients? Um, the the solution you have to order. I don't know what's the specific name order. Alright, so I'm just pretending like he doesn't have any allergy with the nutrition or solution. Yep. Alright, so the first thing, I will open his belly, his abdominal. Oops. Alright, and then this the tube is gonna be right here. The first thing I will do is I will inspect his G tube. So I will look the skin around, make sure there are no edema, no redness, no warm, and no any sort of infection, no tenderness. Yep, and then I look on the 4 quadrants. Yep, and then I will listen to his for all 4 quadrants before I administer the nutrition through the G tube. Yep, so I will take my stethoscope and I will listen to all his 4 quadrants, from the left lower quadrant to the left upper quadrant to right upper quadrant and down to right lower quadrant. Yep, so I just want to make sure they're like all all regular bowel sound before I administer tube feeding. If they're like absent the sound, I will on hold a patient. Yep, I will leave the room and I will call to the PCP or I will call the doctor. Alright, so everything is looking great. So right here I have the 60 ml syringe. I will open the G tube and I will use the alcohol swab, and I just kind of swab it for like 20 seconds, and then I will inspirate the syringe up. Make sure they are like less than 60 or less than 70 ml of a residual. Yep, so everything is looking good. So he just only have 30 ml in his stomach. Alright, so I will push it back, but I just keep a tiny little residual, and then I put it right here to the kidney basin. Emerson basin. Yep, and I will have a strip of the pH. So I will dip the pH into the basin. So this look like the range is like 3.5 to 4.0 pH. So I think this is good. So look like he's the G tubes in his stomach. I think I will get ready to give him a tube feeding. That's the positive case. But for the worst case scenario, if the pH is like above 5.0 or above 6.0, which is very basic, I think I will on hold a patient. Yep, and I will measure the G tube. And then for what I've been so for the all information I've been collected, I will call the PCP and let the PCP know that everything like the pH is like above 4.0 or 4.5, and then let the PCP come here to see him. But everything is looking good right now. Alright, so I have the solution right here, free water, towel. Yep. Alright, so Mr. John, if that's okay if I give you a tube feeding right now, the nutrition solution to your tube. Yep. Alright, go ahead, man. Alright, so from now, I know my back doesn't have any elevate, so I just gotta pretending like, so his head and his back is like above 30, oh sorry Mr. John, above 30 degree. Yep, just like that. Alright. Alright. Oops. I just dropped nutrition solution. I definitely I can, if I drop something on the floor, I'm not gonna pick it up. But you know, this just like I'm just pretending. So I just got like I just get the new tube fitting. All right. So with a 60 ml syringe, yep, I will take the tops out. Yep, and then there's like a hole right here. So I will put it to the tube. Alright, I will make sure the flow is go straight out. Alright, so I will start with like 15 mLs of free water. Yep. Alright. So everything is great. And then with the solution, I will put like the nutrition solution. I will put in like you know 30 mLs. Yep. And then everything's flowing great. I will put like water, free water, like 10 to 15 mLs of water in, and then I repeat the nutrition until it's done. The procedure until it's done. So meanwhile, I will inspect patient if he has any sign of aspirate, but look like he's doing good. Right, Mr. John? Alright, so everything is looking good. So I will take the 60 ml syringe out. Yep. Alright, and I will you know, close the G tube. I will clamp it and then I will put it back. And by the way, I will make sure that the dressing in here is still good. If the dressing is like, you know, expire 24 hours expire, I will change the G tube dressing, and I will make sure everything is in place. Everything is good before I leave the room. So after I done with the G tube, I will ask Mr. John, Mr. John, is that okay if I leave your heads up for like an hour approximately, because I don't want you to have any aspiration. Alright man, sounds good. Alright, so sounds good. And then I will put the sign rules up. I give him a call button, or call bell, call light. And I will ask him if he need anything else. Mr. John, do you want me to do something else before I leave the room? Oh man, can you turn on the Jerry Springer show for me? Okay, yes, Mr. John, I would happy to. Alright, so Jerry Springer, enjoy the show. You need something, let me know, okay? And then I will form out. And have a good day, Mr. John. That's it. Alright, so that's it. That is my tube, the fitting, I mean the G tube fitting procedure. I always make sure everything is nice and clean. The bed always like elevate to my position. You know, so I have a correct body alignment, and safety first and always. And that's it. Thank you so much, Dr. Thank you so much, Dr. Brazee and Faculty.